All right, so we are going to go ahead and start with canine bacterial cystitis. I have made sure that I made my notes for today on the board, and I'm also here if you absolutely need me to answer questions. All right, so we're going to start with our canine bacterial cystitis. This out of the way. So the causes behind this, right? So you already hear it's bacteria, right? So bacterial cystitis. We've talked about cystitis with kitty cats, and then we kind of went through how that's not bacteria. And so for this one, if you look at the name of it, it's canine bacterial cystitis. So you know it's bacteria. So the cause is going to be that ascending bacteria up the urethra. Um, UTI is most commonly the result of migration of bacteria up that urethra. It is the most common cause of cystitis in dogs. So if you do see cystitis in dogs, then you're going to see that it's usually caused by bacteria. The bacteria can develop when feces or debris enter the area. Once it's in the bladder, they colonize in the mucosal lining, right? And that's how we're going to see that bacterial infection. So signs that we will see increased frequency of urination, hematuria, which we've talked about that, dysuria, and they might have difficulty urinating, cloudy urine. It could be abnormal color. And then sometimes they'll lick at that vaginal or urethral area just because it's irritated, right? So that's something that we can see. So, diagnostics here, we have our urinalysis. So we'd have an increase in our white blood cell. We are going to have a increase in bacteria. So that's something that we're going to be looking for. The most common one is E. coli, and the Proteus species. So E. coli tends to be a bit of a problem these days, right? We see it with a lot of our situations. Urine culture and sensitivity. So you collect by cystocentesis or midstream. You just want to make sure that on the paper you indicate how you collected it, so the lab knows what the amount of bacteria to be looking for, right? Obviously, cystocentesis is going to have less bacteria than our midstream collection. So treatment, antibiotics, according to that culture and sensitivity, it can sometimes take about 24 hours for it to come back. Treat acute infections for usually 10 to 14 days. The chronic infections are going to be for 4 to 6 weeks. Sometimes dogs just have to be treated, for a longer period of time. And then avoid trauma to the urinary tract during surgery. So if you have a patient and for whatever reason they are having some sort of abdominal surgery prior to this, we usually always, even orthopedics really, we always will test their urine to see if they have some sort of urinary tract infection, just because it's a little bit more difficult to treat with surgery, right? So you're doing surgery, you don't want to predispose them to something more. And then patients needing indwelling catheters, they should have a closed system, right? So we don't want it just like open, leaking everywhere. That's kind of the biggest thing. So this here you can see, this is a urinary catheter system. And so the only thing I would change here really is I would attach this. So where you can see where it's coming out of the patient, I would attach it maybe up on the leg. Uh, you can, or maybe up a little bit further, but you can either like use suture and suture it on to the patient. Like you can take tape and kind of cover the line and then suture it. Just because if they step on that, they can not only kink the line and we won't be able to get that appropriate urine flow, but also it hurts, right? So there's like when you think about a urinary catheter going in there, there's a ball at the end that they use to inflate. And when they inflate that, it's inflated. So if they were to step on it and pull, that could be really painful. If you look closely to the tail here has a wrap on it, that's probably because this dog may have been having diarrhea. And so sometimes we would wrap their tails just so it would be a little bit easier to clean so they don't have, diarrhea all stuck in their hair. So what I'm going to do is I'm going to show you a video of a urinary catheter in a female dog. I don't have a good one for boy dogs. That's really like similar to the red rubber, but a female one is a little more complicated, and I thought it would be beneficial. Here's the video.
So we're getting ready to put a urinary catheter in this dog because she's a possible lepto suspect, meaning she possibly has leptospirosis. And because the disease can be transmitted to people through urine, we typically have a urinary catheter in place while they're on antibiotics for the first 24 hours. Um, Once those 24 hours are up, we'll oftentimes can, depending on their fluid status, can continue to have the urinary catheter in place or can remove the urinary catheter and kind of take down all the barriers and stuff that we've set in motion.
Yeah. And so we're going to prep this patient's vulva in preparation to place a urinary catheter. We just want to use a dilute chlorhexidine scrub or solution. And then I'm going to flush her vaginal vault again with a dilute chlorhexidine solution.
So we're getting on sterile gloves because we want to place a urinary catheter as sterilely as possible. And so we've opened up most of our materials ahead of time, including our 8 French 55 centimeter Foley catheter. And we have some sterile lube right there. We're just adding in a stylet to increase the rigidity of the Foley catheter. Oftentimes they're really soft and malleable, which is good for having in the urethra of a male or female animal. But for placing it, the stylet often will give us a little more control. All right, so we have the we finally have the stylet in the Foley catheter, and we have some sterile lube on the fingertip for digital palpation as we're passing the Foley catheter. And so we'll insert the finger, and we ideally in a large dog should be able to palpate the urethral papilla, and then we'll send the Foley catheter kind of ventrally to that. And sometimes we talk about either kind of pressing your finger down a little bit to kind of push it in there, or sometimes even kind of lifting up to prevent it from going into the vestibule, basically. And so we have this dog in lateral recumbency right now. You can also do it in sternal recumbency, is another way that's often done. We have the legs pulled forward. So you usually can feel the urethral papilla kind of over the pelvic brim on the vaginal floor. This dog's big enough for palpating. It's pretty straightforward.
So we're inserting saline into the side port to inflate the balloon. We're attaching a female adapter port at the end of the Foley catheter to connect it to the closed collection system.
Now that the balloon is inflated, we can pull back on the Foley catheter until it meets resistance to know that we're kind of right at the trigone of the bladder. Then we're just connecting the Foley catheter to a closed collection system so we can prevent basically anyone from getting exposed to the possible lepto urine. So now we're just going to attach.
So again, they have all this PPE on because of possible lepto, and that's zoonotic, right? Normally you don't have to wear this much PPE when it comes to just placing a urinary catheter, and then you're going to actually get to see what they're going to do to help kind of keep the urinary catheter out of the way so it doesn't get stepped on.
The Foley catheter with the closed collection system to the leg just to prevent any tension from being put on the urinary catheter. And so if there's some reason the dog steps on the closed collection system, the tension will get placed on the line at the leg. So we and took kind of one long piece of tape and kind of folded it over both sides of the Foley catheter, kind of folded it on itself to make a kind of butterfly piece to add these sutures to kind of attach it to the leg. Since we don't want to attach the Foley catheter, it's suture the Foley catheter itself directly to the leg. And that's how we place a female urinary catheter in a large dog.
Okay. All right, so now you have seen a urinary catheter placed. So that should be helpful. Again, like I said, the female dogs, it's a little more complicated as to, how we place them. They're not going to be as easy as it is on like a boy dog. All right, so many uncomplicated UTIs, they'll resolve without treatment. Give antibiotics as directed for the time prescribed. The prostate may be a source of reoccurring infections. We've kind of talked about that, right? We know that the prostate, really, it's the location, right? Where it's located. It's literally around the urethra. So that's why we can kind of see this. And then urine culture should be repeated during treatment to assess effects. All right, so that was canine bacterial cystitis. We will actually move down since we already went through this. We will move on to the next topic, which is canine urolithasis. All right, so canine urolithasis. This is our next topic. So let's kind of talk about uroliths, right? We did cover this prior. Uroliths damage mucosa of the urinary tract, making it more susceptible to infections. That's something that we did know prior to this. Remember, they kind of bounce around within like the bladder, and they can be pretty hard on the bladder. They can also obstruct urine flow, especially in boys. We've talked about this. Struvites are more common in females, 3 to 8 years of age, and then the calcium oxalate is more common in our male dogs. Urates are actually like one that you see in Dalmatians, and honestly, I haven't seen a whole lot of Dalmatians in practice, but when I have, they have had urates, so I feel like that's kind of interesting. So my question is the most common urolith that you see in a dog. And so I've already actually placed this on the board for you. I wanted to make sure that you had access to it. The most common ones that we're going to see is that calcium oxalate and struvites. And struvites are also known as magnesium ammonium phosphate because they're made from magnesium. So those are going to be the two most common that you know, or that are the most in dogs, right? That you should know. And then also know that struvites is that magnesium ammonium phosphate. And it's easy to remember because it's made from magnesium. So the canine urolithasis, the distal portion of the canine urethra, it has that narrow canal, the os penis, right? So you should have gone over this in anatomy. We always travel a little bit back to anatomy when we do these lessons. And this can actually be a common location for urethral stones to become lodged. So it's kind of interesting. So clinical symptoms, we can see that polyuria. So small amounts, but often, right? Dysuria, so it's difficult to urinate. We can see blood in the urine. If there's stones in there bouncing around, I would expect the blood vessels to be ruptured, right? They start getting ruptured. We're going to start seeing blood in the urine. Diagnosis, that urinalysis, right? So you can see crystals in the urine, which is your crystalluria. You can see blood, right? So hematuria. Increased bacteria, right? Because they're more susceptible once they have stones. And then if we were to do radiographs, if they're radio opaque, right, we could see them on a radiograph. So this is just showing you some images. So this one here, there's that large one, right? So sometimes it can be one huge stone. Other times it can just be a bunch of different ones, and they're, they vary in size. I did have a case one time, this dog was urinating. I mean, this looked like straight blood. It was so sad. She was so painful. She was urinating just straight blood, like just dribbling. And when we did a radiograph, her entire bladder was like just a huge stone. And like there just wasn't really room for urine. And so that's why like she was just constantly leaking urine, right? It was so sad. Unfortunately, the owners didn't have a whole lot of money, so there was only so much we could do. So we gave her a diet in hopes that maybe we could get it to dissolve, but I never got a follow-up on it. And cases like that are always just, those are hard because what she really needed is she needed that stone removed, but they just, they couldn't afford it. And so we were hoping that it was a diet such as like Struvites that we could, dissolve with a diet versus having to do surgery, hoping it was that type of stone. So types of stones cannot be determined by appearance. We actually have to send them out. So we have that stone analysis, right? That we send. We just take the stone, we send it out. Some of them actually look very similar, so you can see why that can be a little concerning. That's kind of the biggest thing that you kind of look for. So again, yeah, that's just a big thing is we need to send them out. Sometimes owners don't want to pay for us to send these out, which is valid, right? If that's the case, we'll just remove them and we kind of just move on, maybe start them on a diet based off what we think it is. That's really the next step. So medical management dissolve stones if they're struvites. So remember, struvites are going to be the ones high in magnesium. So we can actually use a prescription diet. We can acidify the urine. We acidify the urine feeding diets low in magnesium, right? So a diet low in magnesium. I'll make sure that this is going to be on the board for you, right? So if you look, it's going to be there. So low in magnesium. And so it'll be up there for you. So urine acidifiers, right? We could also do that. We could add something, increase urine output, trying to get them to take in more water. That's always going to be helpful. With calcium oxalates, we actually have to surgically remove those. There's no diet to actually break those down. So they're not going to be beneficial for medical management. So unfortunately, if they're the case, and we don't know which one it is, we could try medical management, but if they don't start to dissolve, then we know that we have that calcium oxalate. And so these need to definitely be removed. Prevention is key. Stone analysis is going to be vital for that appropriate treatment because we don't know what type they actually have. All right, so as you can see, we kind of went through this. This would be a cystotomy. I'm going to go ahead and show you a video of them doing a cystotomy on a dog, just because even though it's very similar to a cat, it's a little different just because they're a little bigger, right? And the video I'm going to show you has a dog with a quite large stone. So we'll go ahead and watch that. All right, so I'm going to go ahead and move me out of the way, and then I'm going to play this video.
Hi, this is Jewel, and Jewel came in the clinic because she had trouble peeing, and we're going to do a surgery on her, and I'll show her why we're going to do surgery. Poor Jewel. Hi, Jewel, you gotta go to sleep now, and we'll see what you look like inside. Bye-bye, go to sleep. So, Jewel came in, and she was having trouble going to the bathroom, and here's her bladder. And each one of these are bladder stones, and all those are bladder stones. So we're going to take a whole bunch of little bladder stones and big bladder stones from her bladder. To orient you, this is her abdomen. That's her vertebrae, her hips, her femur, her abdomen. These are intestines. Kidneys are kind of hidden up in there. You can barely see the outline of one. But this bladder stones, the bladder is always right in this area, right as the pelvis comes in, the urethra will be here, and then this whole big area are stones. So let's take a look at them on the x-ray. And then we'll see them inside in just a few minutes. We have to shave a little place on the belly so we can get in. We're going to prep it up, and we're going to get it all ready and make our incision and see what's inside that bladder. Even though we already know what's inside, we saw it on the x-ray. Jewel's now under anesthetic, and I've washed my hands, got all the bacteria off, and I'm putting on my gloves so that I protect Jewel from my nasty bacteria. Because human, we don't want to get our staph or our strep bacteria or, God forbid, E. coli into the wound. So now I'm sterilized and ready to go. So let's go in there. Let's see what's inside of Jewel. We're putting on the towel clamps in order to keep the sterile drape in place. The sterile grate is there to protect me from dragging Jules bacteria into this clean area. So that's an incision through the skin, and then we make an incision through the muscles, and we keep going. So we get into the abdomen. And there, now we're into the abdomen. There's fat. We're going to open up the incision with our scissors, like that. And then we're going to look for the bladder on the area to protect the area from getting pee-pee in the wound. Pee-pee or urine. Suppose I'm a doctor,
I forgot that he keeps saying this. It's actually kind of entertaining. So hopefully this is making you laugh.
call it urine, but I call it pee-pee because it's people know what pee-pee is more than they know what urine is. Well, I guess most people know what urine is. Well, I guess I should really stop. That really doesn't make sense. So anyway, now we're going to cut a incision into the bladder between these little blood vessels. Can you see those, Kimmy? Blood vessels right there. We want to cut between them so there's less bleeding. So let's cut. Oh, here comes the pee-pee. Okay, and then the interesting thing is, then you look inside the bladder and you can see stones. See those stones? Let's look. There's one. It's minerals. And she's got a bunch. There's some more. These are all bladder stones. There's just zillions of them forming. She could pass most of these things, except for these would be hard to pass, but there's just big ones and little ones there. And then if you look over here in the bladder, you can see she's got all kinds of little ones here too. Now we're going to sew up. You can see the stones right there that we took out, which I've showed you several times. And now we're just going to sew up the bladder. It's a you ever had a Bota bag? It's a bladder is kind of like a Bota bag. And we're just going to make it hold water again. So we're going to sew up the hole. Within a couple of days, it'll be ready to, it'll hold water right away. And just in a few days, it'll heal up enough to stretch and go back to its normal function. And then in a week, several weeks, these sutures will dissolve. So we'll put a continuous suture in there, which is one that you don't cut each time. And we'll just take the edge of the bladder, go through it, go through the other side, and go all the way down to the end. Hi, Jewel. There you are after surgery. Resting comfortably. And to flush out the bladder and the kidneys, we have the urine, not the urine going through the bag, but sodium chloride. It goes down the tube and into Jules' leg. We want the fluids running because it flushes out our kidneys and our bladder. And we'll talk a little bit about what dogs should eat and why they make those stones in their bladder in a second.
How do we treat stones? Well, we remove them if they're too big to pass or if we don't think they'll dissolve with a special diet and antibiotics. We culture urine to make sure that they don't have a bug in there that we're not treating. And we analyze the stone to see what the percentage of calcium and phosphorus in it, and magnesium. What that means is certain stones have certain percentages of minerals, and some of them do better with some diets over others. But interestingly enough, in the past, it's only been infection and genetics to be the biggest cause. But I think our dry, high-grain kibble has a big role in urinary infections because studies show that humans in poor areas of the world, underdeveloped areas, get higher incidence of stones when they eat more grain because they have less meat in the diet. Meat will actually make the urine very acidic.
Okay, so he just kind of goes through and like obviously we know that diet plays a huge role. All right, so we can get back to the PowerPoint. So let me get my notes. Okay, so you got to see that, kind of look at this. So what do you see here, right? So we can see stones here, and then we can see stones like down this way. So this animal might actually be starting to get blocked, right? So we can definitely see that. So when you think of, information, special diets may be required for life. Table scraps, treats should be limited. Long-term antibiotics may be required, especially if it keeps happening. Uroliths may reoccur at any time, right? If they aren't on that special diet, that specific diet that they need to be. Always provide plenty of water and then allow plenty of bathroom time and frequency for our pets, right? So that's going to be one of the important factors. So we're going to move on to the next topic. And so this one is going to be our renal failure, right? So this is a big one. You definitely see renal failure in animal medicine. It's a huge thing that you see. It's like I always see the old kitty cats, and I'm like, oh, great, now they're in kidney failure. So 20% of cardiac output is actually passed through the kidneys. So the kidneys are super sensitive. And so we'll talk about that when we get to emergency, where the kidneys get real sensitive, and that blood circulation, like low blood pressure, high blood pressure, that kind of stuff, they tend to react to that. So when you think of that, 20% of cardiac output is going through the kidneys. So again, that's a good amount. So filtered by renal corpuscles, reabsorbed by the kidney tubules, waste is excreted as urine. This picture should have been pulled straight from the anatomy book, right? So you can see the loop of Henle, all of that. Renal failure could happen due to lack of blood flow, so that hypoperfusion, damage to a nephron, and glomerular filtration. Once there's damage to the nephron, that glomerular filtration declines, resulting in azotemia. And as we've mentioned before, azotemia is going to be toxins built up in the blood, and so that's going to be right there on the board for you as well. So these are the three types of azotemia. I have these written out for you. So we have pre-renal. This would be before the kidneys, right? So that's kind of a big thing. This is the most common cause of acute renal failure due to the lack of blood flow. So dehydration, right? So dehydration could lead to acute renal failure. So that's insane. Like dehydration is really dangerous. So hydration is like, it will literally save your life to drink water. Renal, obviously, this is primary, right? So primary kidney disorder. There's a problem with the kidneys themselves. And then that post-renal is that urinary tract obstruction. So like our blocked kidneys, right? We've kind of gone over that. We know that that can lead to azotemia. So all of these things can cause toxins to start building up in the blood. So when you think of acute renal failure, there's three distinct phases. So the first one is induction. This is the time from the initial insult until the decreased renal function is apparent, right? So hours to days. The maintenance, this is the time period which renal tubular damage occurs. So what weeks to months, like this is happening over time. And then recovery. This is the time during which renal function improves. So it's really cool. The body does a lot of things to try and like compensate. And so one of the things that it does is the existing nephrons will hypertrophy, so they get larger and compensate for those damaged ones. And they can do this, when it's when possible. So I think it's kind of cool that the body like tries it steps in, and it really does try to compensate and fix the problem. So our stages of kidney disease, the first one is loss of renal reserve. So the early signs are that polyuria, polydipsia. These are just like, when you hear that loss of renal reserve, the functional changes within the kidneys are occurring. So that's all it is. It's like, it might not even be noticed right away, right? So that polyuria, polydipsia. The next one is renal insufficiency. So again, early signs, polyuria, polydipsia, 66% or more nephrons are lost here. Blood and urine screening is essential for detecting at this point. The next one is renal failure. So that azotemia, right? Once they hit that renal failure, we're going to have those toxins building up. It's actually nitrogen. Kidneys cannot eliminate waste effectively, causing signs of illness, right? So 75% or more of nephron loss. And then the last one is our advanced kidney failure, right? So that uremia. So uremia is blood or is urine in the blood, right? Urine has now spilled over into the blood. So that's really bad. Severe signs of illness, they could collapse, it could result in death. 90% or more of nephrons are lost at this point. So when you see that uremia, we have a really big problem here. So when you think of acute renal failure, it's going to be that decrease in glomerular filtration. We have that azotemia. The causes would be damage to the nephrons, right? Nephrotoxic drugs. Some drugs can be very toxic. Aminoglycosides, these are ones that we can see usually like just depending how often we need to use them. Chemotherapy. Chemotherapy is it's such a nightmare because you're trying to treat one thing, right? And you can cause other issues. Antifungal medications. We haven't got there yet, but when we talk about dermatology, we're going to talk about how sometimes overusing antifungal medications can actually cause like liver, kidney damage. Analgesics, acetaminophen. So that Tylenol, right? So Tylenol overuse can definitely be toxic to the kidneys. Anesthetic. Thankfully, we don't use a whole lot of this the methoflurane. We actually use a different one, but a lot of hospitals, they try to use less gas and they try to use more drug therapy because it's a little bit safer. Ethylene glycol, so antifreeze. We will talk about this in toxicology, but ethylene glycol, that antifreeze, it's really sweet. And so animals tend to be attracted to it. And what happens is they will end up drinking it. And it can cause their kidneys to shut down in like less than 18 hours. It's really dangerous, especially for kitty cats. Even like the tiniest amount on their paw pads and licking it can be very, very dangerous. And then antibiotics, amikacin. This is just a pretty strong antibiotic. So, overuse of this could be dangerous. So acute renal failure, again, more causes. They could have an infection, so that pyelonephritis, so inflammation of the kidneys due to bacteria. They could have an immune-mediated disorder, so glomerular nephritis. So in this case, like the glomeruli, what filters blood within the kidneys, when it's damaged, it doesn't filter correctly. So we'd have a decrease in renal perfusion that could also cause acute renal failure, maybe if the patient's in shock. Hypovolemia shock's a big one, decreased volume of circulating blood, right? Um, and so that dehydration again, and then hypotension, the kidneys do not like when the blood pressure is low. They're very sensitive, and so that can be a lot for them. So more like signs, these are non-specific. Kidneys are enlarged. They could be painful on palpation. You don't see that a whole lot. Signs of that azotemia, right? So anorexia, dehydration, vomiting, diarrhea. They could be weak, sometimes a fever. So it just kind of depends. It's not, these are, again, non-specific. They don't scream that they have urinary issues. So what we can do is we can do a urinalysis, that urine sediment. There's all sorts of different casts you will see. You may have gone over that in clinical pathology. I'm not jumping into the cast discussion today. Low specific gravity, unable to concentrate urine because the kidneys, again, are not working appropriately. CBC, so it would be increased, right? When a patient's dehydrated, their PCV is going to be elevated. And then the chemistry panel. So we're going to be looking for that BUN, that creatinine, right? So BUN, this test is done to see how well the kidneys are working. If they're not able to remove the urea from the blood normally, the BUN will rise, right? Blood creatinine levels, this tests their function. So the kidney's ability to handle creatinine. So it's that creatinine clearance rate, which helps estimate that glomerular filtration rate. So it's letting us know, again, if these are elevated, that the kidneys are not working correctly. And so treatment, we just need to restore that renal hemodynamics, right? The blood flow. We want to get that blood flow back to normal. So relieve any urinary obstruction, discontinue any toxic medications, which sounds like a given. Correct the dehydration. We're going to want to give them fluids, right? Correct acid-base imbalance. We need to provide them with whatever they need based on their blood work. So information, renal function may never be like it was before. The prognosis is guarded, especially with our older pets. It's, their kidneys just aren't working in general like they should. Care must be taken to avoid events that could, further damage the kidneys. Make sure we have appropriate diets. The kidney diets are great. Not only are kidney diets good for kidney disease, they're good for cardiac diseases, other conditions as well, right? Because they're just Basically, what they have in them is safe and good for the body. Adequate water access. A lot of times the kidney diets are like the stews, so they have a little bit more water content, so we can get more water into these guys. All right. All right. So chronic renal failure, right? So this is just more like of our chronic cases. So common in older pets, cats appear to be more affected than dogs. It's kind of like an ongoing thing. You see old kitties and you're like, oh, there they are, renal failure, which sounds pretty horrible, but that's just life. So irreversible, progressive, decline in renal function. So there's that nephron damage. We are now at that really end point, right? It's chronic. So when you think of this, it's progressive. So the first function lost is their ability to concentrate urine. That polyuria, that polydipsia, they end up with nocturia. This is a condition where they wake up during the night because they have to urinate. That loss of ADH response. So that antidiuretic hormone, it's released from the brain and it goes to the kidneys to control the amount of water being reabsorbed. And so basically, they're not listening to ADH anymore, which can be concerning. Other functions lost, ability to filter blood, right? So we can end up with that azotemia. This begins at 75% of nephron loss. So I feel like that's a pretty important number, 75% of nephron loss here. So we have an increase in that BUN, which is your blood urea nitrogen. So blood urea nitrogen, and then that creatinine, right? And then we can also see anemia, right? So we know erythropoietin is produced by our kidneys, right? So if the kidneys aren't working, it's not sending out erythropoietin, which means erythropoietin is not going to the bone marrow, which means the bone marrow is not being told to make red blood cells, which is concerning, right? So that's when we can start to see that anemia. So now we have this older pet, they are in chronic renal failure, and they also are, fighting with anemia. So that's just never a fun case. Something else we can see is dull, lethargic, weak animals. They can be anorexic. They can have that weight loss. The polyuria and polydipsia, there's also something else, right? So hypokalemia. Man, we've been talking about low potassium for weeks now. So that low potassium, it causes generalized muscle weakness from excessive loss, right? So in this case, these patients, they can end up having like cervical ventriflexion where their head is like stuck down. I've seen this before on a chronic kidney case, and it's very interesting. Their head is just kind of stuck. So now we have low potassium, right? Because again, the kidneys aren't working like it should. And so we can end up seeing that, especially like if they're starting to feel like they have those azotemia symptoms, right? So now they're vomiting a whole lot. So we're losing even more potassium. So now we're just going to have low potassium just floating around, which we've known from, we've been talking about this. High potassium's bad and low potassium's bad. So diagnosis, right? So look for abnormal blood work associated with kidney function. Look for that anemia. See what that BUN is. Make sure that see what that creatinine is. Proteinuria too. Proteins will build up because the kidneys aren't filtering like they should. So these are things that we're going to be checking when we have a chronic kidney case. And so what I need to do, right? I need to treat them. So fluids for dehydration, you can do IV. Sub-Q's on here too, because what happens is these cases, the owners sometimes have to buy a whole fluid bag and we have to teach them how to give sub-Q fluids. This way they can give fluids to these pets while they're at home. So they don't have to keep bringing them back every couple days to get more fluids in them. Correct electrolyte imbalance, right? Depending what they need. And then there's a hormone that we can give them, epoetin. It's a man-made form of protein. It helps the body produce red blood cells. So this is something that we could provide for these cases if they needed it, because their kidneys aren't working. They're not going to make blood cells like they should. And then information, right? So that chronic renal failure, it's progressive, it's irreversible. Treatment is aimed at slowing the progress of the disease. Sub-Q fluids at home are required to maintain hydration, right? So this is important. And then quality of life will decrease. Euthanasia is going to need to be considered at the end. A lot of these kidney cases, they do end up bringing them in at some point. They've done everything they could. They did the sub-Q fluids at home. They've provided them with the medications. They've done all that they can. And so when the animal stops responding, they know it's time. So unfortunately, chronic renal failure does usually lead to the question of, is this good quality of life? All right, so we finished chronic renal failure. All right, so urinary incontinence. This is the one of the last things that we cover. This is a different situation. You will see this unfortunately, right, this is going to be that loss of voluntary control. So they're unable to control their urination, and so there's so many different causes behind this. And there's just ways that we can try to fix it. So the neurogenic, so loss of normal neural function, this is causing that paralyzed bladder. So that would be like maybe a patient with like spinal cord disease. So sometimes with the spinal cord conditions, it's really weird. So sometimes you might have to express their bladder, and then other times, depending on the type of spinal cord damage, they might not have any control and just urinate, right? So it could go both ways. Ectopic ureters, we're going to talk about that today. That means that they are in the wrong location. The patent uricus, this is so interesting. So this is the tube that carried fetal urine to the umbilicus. It doesn't close. And so what happens is the animal will actually dribble urine from like where their like belly button technically would have been. And I had a case like that in ICU. The owner brought them in and the dog constantly had urine scolding, but she kept explaining to like the doctor and us, like whenever she came, she was like, she's dripping. It's like she has urine all over her, but I'm not seeing it drip from like her vulva area. And so it's because it was coming from her like belly button area. And then endocrine imbalance after spaying. So sometimes with that estrogen, the levels like can change very quickly, and then they can end up having issues with urinary like control. Not often. So this is going to be, again, that ectopic like ureter. You can see the wrong location. So if it's skipping over the bladder, they're just going to constantly be urinating. And so what we have is signs, right? So urine leakage when the pet is sleeping or exercising. Perianal area of the pet is always wet. Concurrent urinary tract infection, right? Because it's like there's constantly leaking urine. More prone to bacteria. Urinalysis, we can be checking that. We can do cystography just to see like what's going on. So you could use imaging to see like where the connection is, where the problem is, and then chemistry panel to rule out like polyuria from endocrine disorders, maybe like diabetes, right? So diabetic patients will urinate more, and we want to make sure that that's not actually what's occurring. And then treatment's going to be based on specific cause, right? So surgical correction, depending like what's anatomically happening, endocrine deficiencies in this spayed female. Proin is a medication that we use. I'm smiling because Proin it helps with that loss of sphincter tone. And actually in some states, I believe in New York, it is controlled. It's not controlled here yet, but most doctors lock it up anyway because it has a very high abuse rate. Like you can definitely abuse it. So it probably needs to be controlled. We can talk about it later, not on recording. But so Proin is one that you'll see it, and it's actually treated as a controlled substance, but it's not here in Texas. And then information doses will have to be adjusted for individual animals. Paralytic bladders, incontinence, and may require manual expression or catheterization. So sometimes too, it's like if the bladder gets too full, then that's when they're just going to continuously leak. And then catheterization might be the only thing that can help. And that is everything. So you finished urinary.